All right, looks like everybody's in the room now. I want to welcome you all to the CHAMPS webinar. Before I do, I want to make sure that we welcome Jacqueline Berger and Madhav Logani from the CHAMPS team, as well as Laura Burnham. And Jackie is going to be running the slides for me today. So Jackie, you can go ahead and get the slides up and get those ready to go. We're excited to have you all today. I'm very, very excited about providing this webinar for you today.
Welcome, everybody. Thanks for being here. Just a reminder to please keep yourself muted so we can listen to Cathy and her great presentation. I'm going to go ahead and share my slides for everybody. And if anybody can't see, please let me know and I will reshare.
All right, wonderful. Thank you very much, Jackie, for bringing that up. And thanks again to all of you for participating. I want to invite you to use the chat box if you would today and let me know who's here. Maybe let me know what your role is at a hospital or WIC or community, wherever you are calling in from, so that we can capture that information. I'm excited about this information. I've done a couple of small webinars related to Mississippi Wins, but this one today is going to be really focusing in on the practical solutions and steps for building lactation support in a hospital setting. Now, I know some of you on this call already have a lactation support program in place, and actually a couple of you, I saw your names. I know you have a very good lactation support program in place. We're very happy to have you. You may be looking for a few tips to see if there's anything you can do to build on what you have already started to take that to another level. Some of you may have a few things in place, but you already know you need to build a lot in order to grow those accommodations and support services to better meet the needs of your staff. And some of you may be here because you do not offer accommodations at all, or you really don't have much of anything in place and you're trying to figure out where to get started with that. So we hope that at the end of this webinar, we will have addressed all of the issues and concerns and needs that all of you have. This is going to be a very practical webinar, and I would like to invite you to consider sharing the link to this webinar. This will be posted shortly after the webinar is completed, and we would maybe suggest that you share that recorded link with your HR department at your hospital, maybe with your department or unit managers, and with your colleagues as well, because I think lactation support works best when we have buy-in from multiple departments. So we can go to the next slide, Jackie. I do have a couple of disclosures. I do have prior contracts with the HHS divisions at the federal level. That was the work that I did for the business case for breastfeeding and the Supporting Nursing Moms at Work initiative. But I also do a lot of state contracts and do work in this realm of breastfeeding support in the workplace in terms of conducting research, working with businesses in the community, and also developing resources. So let's move on to the next couple of slides to celebrate, Jackie, if we can. We're going to skip past that first one. And again, you all let me know who you are. We'd love to take a look at that. So we just celebrated Juneteenth a couple of days ago, and we know America's Independence Day is coming up soon as well. So I was thinking, while we're in this mode of celebrating, it would be appropriate to share a few things that we're celebrating with the Mississippi CHAMPS program. So CHAMPS, as many of you know, stands for Communities and Hospitals Advancing Maternity Practices. This is a project within CHEER, which is the Center for Health Equity, Education and Research at Boston University. So CHAMPS began in the southern part of the US in the year 2014, and our goal at the beginning was to improve maternal and child health outcomes by promoting breastfeeding and baby-friendly practices. But since the year 2017, our work has become more focused on Mississippi, where at that time there were no baby-friendly hospitals and the breastfeeding rates were the lowest in the country. Next slide, Jackie. In the February 22 issue of Pediatrics, there was an article published. I hope some of you have had a chance to look at this article. I've included the link here. This is a tremendous article talking about just the incredible results of the CHAMPS initiative here in Mississippi. And it describes the fact that the number of baby-friendly hospitals that have been designated in Mississippi have risen from 0 to 22, and now that number is 23, now that we've gotten news recently that South Central Hospital in Laurel has been designated baby-friendly. And these hospitals represent a little over 60% of our state's delivering hospitals. So we're very excited about that. We also know that the breastfeeding rates have increased dramatically. Our maternity care practices, particularly skin-to-skin practices and rooming in, have dramatically increased over the time that CHAMPS has been working with our hospitals. And I think equally as gratifying to us has been the fact that disparities between Black and white dyads has decreased by 17 percentage points, which is just huge. So on the next slide, you're going to see some information about those rates and the CDC breastfeeding report card. So Jackie, if you'll take us to the next slide. I like to point out that despite these tremendous successes that we've experienced, that our breastfeeding rates still aren't what they need to be, particularly long-term. Although mothers are initiating breastfeeding at much higher rates, we know that mothers discontinue breastfeeding rather quickly. And you can see from this graph that the rates go down significantly. And we know from national research that many women begin supplementing in the first couple of weeks. But we also see from the research that many new parents stop breastfeeding when they plan to go back to work. So this isn't unique to Mississippi. This is an issue that we see all over the country. This picture on the left is a picture of the biannual breastfeeding report card that the CDC publishes, where they provide a snapshot of breastfeeding support in the US, and they break it down by state and let us see what is happening state by state. And we see every single state deals with issues of exclusivity and issues with duration. And we know from the research that going to work has a profound effect on that. And I wanted to mention that this 2020 report, if you haven't seen it, it shows that Mississippi has now moved ahead of several other states in our initiation rate for the first time in decades. So that is something to celebrate. But of course, we still see that sharp decline in exclusive rates. On the next slide, we'll see we'll talk a little bit about why that is. We know from research that many women do discontinue breastfeeding. Some parents make their feeding decision based on whether they plan to return to work or not. And that's why it is crucial to address their barriers and any concerns that they have during pregnancy, as well as in the hospital stay. If you work in a hospital and you're not asking parents about their work plans, then we're missing the boat there, because we need to let them know that there are options. Many parents don't understand or don't realize that they actually have options, that they could continue to breastfeed even when they return back to work. Next slide, Jackie. One study in a business journal found that 80% of breastfeeding parents in the United States have already fully weaned their breastfed baby within a month after they return to work. So we know something is happening in that first month when a mother goes back to work that makes it difficult for her to continue breastfeeding. So that's what this webinar is about. What can we do to begin addressing those issues with our constituents that we deal with, as well as within our own facilities? Next slide. We know that the issues for working parents can be particularly profound when those people are part of the low-wage workforce, and especially if they are working in very challenging non-office job settings. I want to remind us that even if you are an office setting, maybe you are a WIC agency or some kind of an organization where people do work in an office type setting, we do know that in larger companies, particularly in hospitals and manufacturing plants, that it's often the low wage sector of that workforce that face the greatest challenges. We also see great disparities among people of color. We know from research that African-American parents are more likely to be employed in low wage jobs, and they're more likely to be employed in challenging job settings. Research also tells us that African-American mothers are more likely to work full-time, they're more likely to take a short maternity leave, and they're more likely to work in those challenging job settings. Next slide. And this is why I think the federal law that requires businesses to accommodate lactating employees with reasonable time and private space is there. This law is housed in Section 7 of the Federal Labor Standards Act of 1938, which we usually just called FLSA. This was a law that was intended to address disparities by supporting people who are working in the most vulnerable job situations. Now, the only problem with this law is that because of where they housed it in the FLSA, which it's housed in an area that deals with workers that are working in hourly wages or overtime eligible employees. And because it's housed there, the assumption was that salaried workers would be able to make this work somehow. But unfortunately, that hasn't proven to be the case. Next slide, please, Jackie. So because of that, we have seen that huge pockets of people all over the country are working in job settings, such as nurses in hospitals and teachers working in schools, where although they may be salaried workers, they are not technically covered by the FLSA. However, the PUMP Act has been introduced in Congress. The purpose of the PUMP Act is to close those gaps so that all employees, no matter what their classification is, would be entitled to workplace protection. So you should know that the PUMP Act has already passed the House in a strong bipartisan vote. It is now with the Senate being reviewed. And I will tell you that the president has already sent a letter to Congress telling them, urging them to pass this legislation. So if it is passed by the Senate, we have every confidence that it will be signed by the president and become law. So if you'd like to go to the USBC website at usbreastfeeding.org, take a look at the information that is available there about the PUMP Act and things that you can do. They've got a lot of real easy things that you can do to help encourage your senators and representatives to vote for this act. Next slide, please. So the U.S. Department of Labor is where all of the information about the federal law is housed. We can see that in a lot of other places on the internet, but for sure the U.S. Department of Labor. And Madav, if you could put that web link there in the chat box for everybody, that URL, I'd love for you all to have access to that URL and to check it out. They have fact sheets, they have resources to guide employers in complying with the law. They also have a lot of information. They answer like an FAQ, answering a lot of common questions that people have about the law. So if we could go to the second poll, Jackie, the one on federal requirements for supporting lactating employees, I'd love for us just to check in with you to see what you know about the federal law. Now here in Mississippi, we do have an additional law, but it does not provide greater protections than what the federal law does provide. So our employers here in Mississippi must follow that federal law. So Jackie, if you're able to bring that poll up, we have a few questions to see. So I want you to choose any answer that you think is true. So I'll read off all those answers. You click off all the ones you think are true. Mothers must be given reasonable time to express milk as needed. Employers must provide a dedicated lactation room for women who need to express milk at work. The private space for milk expression cannot be a bathroom. Breaks taken for milk expression are not required to be paid. The federal law applies to all women who work regardless of their work status. And employers with fewer than 50 employees are exempt from the federal lactation law. So I'll give you just a moment to respond to this poll. And Jackie, when it looks like most people have weighed in, if you will submit the answers, that would be terrific. And we'll see what everybody thinks. In the meantime, I'm going to the chat to see who all is here today. And again, welcome all of you. It's great to see such a great variety of people joining us today. All right, Jackie, do we have, looks like the majority of people weighed in?
Yep, majority of people have weighed in. So last clicks, and then I'm going to end the poll.
And if you can post the results so we can see those, that would be great. Oh, great. All right, so it looks like everybody thinks that the private space cannot be a bathroom and that employers must provide a dedicated room and must provide reasonable time.
Let me know when you want to go. I sent it.
And it looks like about 58% of you think the breaks taken for milk expression are not required to be paid, that it applies to all women, regardless of their work status, and that employers with fewer than 50 employees are exempt. So thank you all for weighing in. So I'm going to go through a few slides now, and some of you are correct, some of you actually are not. So hopefully you will learn a little something about the federal law. So let's go to the next slide, Jackie. And I'll talk a little bit about reasonable time first. So federal law states that breastfeeding employees must be given reasonable time to express milk during their work period. Now, reasonable is pretty darn vague. And I know a lot of people have been frustrated about that very vague language, but it actually was designed that way for a purpose. The law was done that way to remind employers and their employees that they need to have a conversation about what their needs actually are. We know, for example, that a woman who is returning to work very soon after the birth of a baby is probably going to need a little more time and maybe an extra break or two than a woman who may be pumping for a baby who is 7 or 8 months older, a year older, or even older. So their needs are going to be varied. We know that a woman whose baby is going through a growth spurt may need to pump more often than a baby who is not going through a growth spurt. So the idea of making it reasonable means that we need to talk about this together and have a conversation. Now, most employees use their usual normal breaks. According to the Department of Labor, the time does not have to be paid time. However, if an employee is already given paid breaks, so the business already provides paid breaks, if an employee is going to use that break period to pump milk, the employer cannot deny her payment just because she is pumping. That actually has come up with a lot of employers. They do have to continue to pay them for those paid breaks, no matter how she is using that time. If she needs additional time beyond that, they do not have to pay that additional time. If she needs another break that is not part of her regular break, they do not have to pay that time. Although I will tell you, many employers have found that it's better to go ahead and pay them and to not dock them for that. It just makes for good relationships and helps them to be more productive at work, but that is entirely up to the business to do that. Next slide, Jackie. So federal law states that breastfeeding employees must be given a private space to express milk. However, the space does not have to be a dedicated lactation room. So that could be a flexible space. It could be a conference room. It could be another person's office or the employee's own office or a lunch break area or something along that line that's used for other purposes. But I will say for large facilities, particularly hospitals, I think having a dedicated lactation room makes a lot of sense. In fact, as a hospital, you may want to consider multiple lactation rooms because of the number of employees that you hire. The DOL also states that the space must be functional for milk expression. So they define functional to mean there must be a comfortable chair, there must be a flat surface of some kind to put the breast pump on. That could be a table, a shelf, a counter, something to put the pump on. And ideally, there should be an electrical outlet. The CDC also recommends that lactation spaces have antibacterial wipes in them so that the employee can wipe down their pump and keep the area sanitary for the next user. Now, this picture is a picture that we took of a woman who is pumping in a hospital in Atlanta. And I wanted to point out this idea of what they did at this hospital. It was really nice. They have 3 individual lactation rooms, and they all look like this. They're very small, but they're pleasant, and you can't see it in this picture, but there's some really lovely artwork opposite where this woman is sitting. Each room has a chair that can be wiped clean, which is what we recommend for hospital, that setting. And that way she can wipe down the handles and the back of the chair and the seat as well. And then each room has the electrical outlet. It has a little table. In the corner of the room, they actually have some brochures and information about pumping and storing your milk and things along that line. But what's really cool about this is it's actually a suite of 3 individual lactation rooms. And just opposite or outside each one of these lactation rooms is a common sink area. So all of the women who are using the space can wash their hands and their breast parts afterwards. There's also a small refrigerator that the women can store their breast milk in. There's a ladies' restroom also located near the suite, so they can take care of their personal needs as well. So I just thought this was a terrific idea. If your hospital has a setting that allows you to be able to create a suite of rooms like this, I think that's just a fabulous idea. The law also says that the room must be private and it must be shielded from view from both coworkers and the public. So if you have a lactation space that has, say, 2 or 3 chairs in it and women are all going to pump in front of each other, they may be okay with that, but it actually is not meeting the requirements of the law. The law requires public or privacy from both other workers and the public. Next slide, Jackie. The law also says the space cannot be a bathroom. After all, I don't think anybody wants to eat their lunch in a bathroom setting, and we should not be forcing vulnerable infants to be succumb to that as well. You know, one of the reasons that the DOL and the law is very specific about bathroom spaces is that there is a lot of airborne bacteria in public restrooms. And because a mother who is pumping is going to potentially expose her baby to that airborne bacteria through the opening in her pump shield, they have said that a bathroom space is not appropriate. Even if you know, some people have said, could we not use one of the larger handicapped stalls? We can use one of the extra stalls and you know, remove the toilet in that particular stall, but it still isn't going to work because you've still got airborne bacteria in that bathroom. So the bathroom space is inappropriate. Now, I wanted to mention that, you know, a lot of people get hung up about what the law requires, and they don't understand that there are some tremendous benefits to them or to their hospital, to their facility for providing lactation support. So Jackie, if you'll go to the next slide, I'll talk about just a few of some of these wonderful benefits. So one of the benefits is lower healthcare costs. So I wanted to mention that businesses, according to our research, have found that there is a 3-to-1 return on investment. So if you are just starting out with lactation support and you're going to be meeting with your, you know, HR department or your, you know, your chief operating officer, your chief financial officer about this, and they're thinking, we don't have the money to do this. I want you to remind them there is a 3-to-1 ROI or return on investment. So that means that for every dollar you spend on lactation support, there's a 3-fold return on that investment. And that's a really positive thing. Most businesses won't do anything unless there's at least a 1-to-1 return on investment. They want to at least recoup their money. But in the case of lactation support, there's a 3-to-1 return on their investment. And one of the ways that we see that ROI is with lower healthcare costs. One study found an annual savings of $2,146 per employee whenever they provided lactation support. Let's go to the next slide, Jackie, and we'll talk about one of the reasons for that. We also see from research that babies who are breastfed are healthier. And not only are the babies healthier, but their parents are healthier as well. We've also seen that because babies are healthier, one-day absences for employees occur twice as often when the babies are not breastfed. So mothers who are breastfeeding are going to be half as likely to be taking a one-day absence due to a sick baby. So it's a huge, huge factor in helping us to keep our staff engaged and retained. Let's look at the next slide. I want to talk about turnover rates. We see there are also major savings when facilities are able to retain their valuable employees. And this is especially a critical issue right now in hospitals, because I know hospitals all over the country are dealing with staff shortages as a result of the pandemic. So the DOL, the Department of Labor, has done some research on this, and they have found that the average return to work rate for US employees who leave and have a baby is about 59%. So, almost a little over 40% of employees who leave to have a baby don't come back to work nationally. However, one study that looked at 9 different companies that have an employee lactation support program in place found that with those companies, their return to work rate was 94%. So employers know that retention and turnover is a huge budget problem for them. When you lose an employee and you have to recruit and hire a new person, train that new person, get them through their learning curve to get them integrated into the system, it is a lot of money. In fact, the DOL estimates that it costs 3 times that person's salary to replace them. So if we can keep these employees rather than having to replace them all the time, this is a big financial benefit for the company. Next slide, Jackie. We also know that family-friendly benefits such as lactation accommodations have also been shown to improve productivity of your employees. They also improve staff loyalty. So of course, this helps us to keep our employees engaged for longer period of time. And I think all of this just shows that lactation support is a no-brainer. It's a low cost and a high return investment. Next slide, Jackie. So I'd love for you to go to the chat box, if you would, and talk about some added benefits. Like what would be some additional benefits that you think a hospital setting would be able to enjoy when they have lactation support? And if you have lactation accommodations already in place at your hospital, let us know in the chat box what you're seeing. And Jackie, if you wouldn't mind, you can unmute, maybe read some of those chat comments as they start coming in. And in the meantime, while you're going to the chat and telling us about some of those benefits, I know we've got Carrie and Melinda Noble from Greenwood LaFleur on the call today. And I asked them if they would be willing to share just a few thoughts about how having lactation support for employees at their hospital has benefited them. So if one of you would be willing to unmute and share a little bit, we'd love to hear from you.
Hey, this is Carrie.
Hi, Carrie.
Well, I want to say that we started our journey with the lactation room back in 2019. When we started the baby-friendly process, we really had to take a hard look at ourselves internally as well and say, we're saying we're baby-friendly, but how baby-friendly are we really? And especially towards our own employees. And so after joining the Delta Breastfeeding Coalition and taking some hard looks at ourselves, not only did we challenge ourselves as a hospital, but also other businesses in the community to look at how to best support our lactating employees. And so thus was born with the help of the Delta Breastfeeding Coalition and our hospital foundation, we were able to provide that lactation room, and that's been in use ever since.
That's awesome. Thank you, Carrie. And it's really exciting to hear the baby-friendly movement at your hospital was kind of served as a springboard for you really thinking broadly, beyond just your patient population, but looking at your employees as well. We've seen that from other hospitals as well, and that's really exciting. Can you share anything about, how you feel this has benefited your hospital, having these accommodations? We have to unmute again.
I do know, just from my coworkers and stuff, the benefit of having one central location that's easy to get to and accessible has been a really big plus. And it's something that we do highlight every time we have a new employee orientation, is the fact that we do offer these services now. And so I think it's just very convenient to be able to be here and step off the floor and pump and be able to jump right back into your routine.
So thank you for sharing that, Carrie. Dr. Noble, do you have anything to add to what Carrie has said? I want to give you the opportunity while we're talking about your hospital. Your hospital is just a model hospital. We're so pleased with all that you all have done.
Thank you. No, I think that Carrie summed it up really well. We, right after we opened it up, the pandemic hit, and we were really going to try to encourage it for visitors also, but of course that fell through with the pandemic. But I'm excited to see how it is used by guests once we're opened up completely.
Right. Thank you, Dr. Noble. Jackie, do you have any comments in the chat box that you'd like to read off?
Nope, nobody has commented in the chat yet.
All right. Well, I'm going to share with you a few things for you to think about. All right. One of the things that I've learned from other hospitals who have set up lactation support is that it's in one way just maybe a way to extend your ongoing QI efforts, because employee lactation support helps to build strong teams. When you're meeting the needs of your employees, not just your patients, but you're also meeting the needs of your employees, that helps you to build a strong team. And when you have a strong team, that impacts your patient outcomes as well. Some hospitals have told me that it also aligns with other recognition they have they're working on. For example, their magnet recognition program. Hospitals have told me that it's a very powerful recruiting tool for attracting qualified nurses, that it also helps them retain those employees, and they feel that it's increased nursing satisfaction. And in that way, it helps them to use that as a marketing tool in staff recruitment. So giving hospitals that competitive edge, I think, is always really important. And other hospitals have told me that it's maybe a way of just creating this culture throughout the entire facility where breastfeeding is valued. We don't just value it in the maternity unit, we value it everywhere. And that spills over into patient care, and that when staff themselves have had a positive experience with breastfeeding because they're supported with it, that they promote it more and they get excited about it, and it really, spills over into how they talk about it with patients as well. And then I wanted to just remind you all, those of you who are hospitals on this call, that you are very well positioned in your community as an institution that people trust. When the hospital cares about its employees through innovative, family-friendly type programs like this, it shows the community that when you care about your employees, you also care about their patients, about the people in the community. It just sends a powerful message to them of who you are, what you stand for, and really what you value. And so in that sense, it positions you as a model of support. I really loved what Carrie was talking about, really going into the community and urging businesses to be doing this as well. It's pretty hard to urge your businesses where a lot of your patients are employed to be breastfeeding friendly if you can't say you're doing this as well. But when you are doing this and you can show that you as a model are also doing this, and then encouraging the businesses in your community, it really becomes that powerful springboard. Let's look at the next slide, Jackie. This was a news clipping that Greenwood LaFleur sent us after their hospital began their lactation program. And again, I thought it was just a great way to get information out to the community, just positioning themselves as an employer who cares about their employees and your patients. So let's go to the next slide. And if you'll give me a pause, I'm going to grab a bottle of water. Okay. So I want to just say, you know, businesses and employees and the babies all win when breastfeeding is supported. So building on that theme of winning, CHAMPS began the community-based initiative here in Mississippi to make it easier for employers to provide that support. We call our initiative the Mississippi Wins, which stands for Workplaces Improving Nursing Support. Next slide, Jackie. So we are going to be working and are working with a variety of different kinds of businesses throughout Mississippi and some target areas. But we began this initiative by focusing on what we consider to be the low-hanging fruit, which would be hospitals as employers. One of the reasons for that is hospitals here in Mississippi are the top employers. Hospitals employ over 62,000 people across the state of Mississippi. They also employ many, many lower wage workers, as well as higher paid staff, such as our providers and nurses. But even our providers tell us that they find it quite challenging to be able to express milk when they're in the hospital setting. So there's a lot of barriers that can make it difficult: rigid time schedules, staff shortages, patient priorities, lack of space. There's a lot of huge barriers that have to be overcome in order to provide employee lactation support. But we know that when hospitals can provide that model support for the community, it really demonstrates that a supportive environment can be accomplished even in difficult environments. And if it can be accomplished in a hospital, it can certainly be accomplished anywhere in the community. So we began this initiative. Jackie, let's go to the next slide. We began with a statewide survey of our hospitals. Our goal was to identify best practices and to identify any gaps in breastfeeding support so we would know how to best target our resources and support. We also hope to learn what hospitals needed in order to either implement a new lactation support program or to build on their existing services. So we issued the survey in December of 2021. It was completed in January. We were very, very pleased. We received an 85% response rate, 28 out of the 33 eligible hospitals. 18 of those hospitals were designated baby friendly. So we learned a lot of important things. I want to briefly share some of our findings, and then we're going to go right into some solutions. So Jackie, let's go to the next slide. We learned that of course, we know having a worksite lactation support policy is not required by federal law. However, we are big believers in the power of policy. We know it's how you are able to sustain workplace accommodations. Without a policy, it's very easy for that support to vanish very quickly when the people who were advocating for it, the champions for it, either retired, moved on to another hospital, or left the program for whatever reason. So we believe a policy is pretty important. In our survey, we found that 44% of Mississippi hospitals, or less than half, have a policy. However, of those 44%, only 7 hospitals actually have a written policy that is included in the employee handbook. And that's where that policy really needs to live. The other hospitals said their policy was very informal. It was very, maybe just a line or two about lactation support was added in another policy, but it wasn't a full-fledged employee lactation support policy. So again, I think without policy, we can't really assure equitable access for all employees. Some of the hospitals have told us that they don't need a policy because they have, a really great lactation team, or they have this wonderful person who really cares about this issue, and she makes sure that everybody knows that if they have needs for breastfeeding, that she will support them. But again, that's not sustainable long term. So I would like to invite all of you to consider implementing a more formal policy if you are able to. Next slide, Jackie. The survey also showed there were a lot of great things that were already happening in Mississippi hospitals. So, for example, we learned that 100% of our hospitals are offering some sort of accommodations. Hospitals told us their primary motivation was their strong culture of caring for their employees. And boy, that you can't put a price tag on a culture like that. So that's really fantastic. Many hospitals also said that lactation support has become a demonstrated need among employees. And we really love to hear that. That means more people are hearing about breastfeeding, maybe as a result of your baby-friendly efforts or the renewed emphasis on breastfeeding, and they're giving it a shot. And so that's really awesome to hear that this is becoming a need. Next slide, Jackie. 70% of hospitals said their motivation for providing lactation accommodations was that it complemented their baby-friendly work. And we really loved hearing that as well. So in these hospitals, it seems that baby-friendly became the springboard for expanding that work to their employees, just as Greenwood LaFleur Hospital did. Let's go to the next slide. And Jackie, if you will bring up poll number 3, I'd like for you all to kind of weigh in on what you believe some of the biggest barriers that you face in terms of implementing lactation support for your employees, or maybe if you already have some accommodations in place, what were your biggest barriers? What were the things that made it difficult? I think if you take some time to think about what those barriers might be, it will help you to troubleshoot and address those as you go along, rather than waiting until later on. So are we able to bring up that poll, Jackie?
Cathy, I have a question. What do women think would value most in the way of breastfeeding support? I don't have a poll about barriers.
Is there, you don't have one about barriers? Okay, well then I tell you what, let's go to the chat box instead, and let's just weigh in the chat box and let me know what you believe some barriers might be. We have what we found in our survey, but I want to find out what you feel, because we have a lot of different people, different groups on this call, and I want to get a handle on what you think some of the biggest barriers might be. And Jackie, you can let me know if anybody has any barriers. And maybe not everybody's able to access the chat. If you're not, we understand that. Jackie, let's go on to the next slide, and I'll review some of the barriers we have found in our hospital survey. And if you're able to maybe add to that list of some things that you think might be a barrier, that will be helpful. We found in our survey that the biggest barrier was staffing issues. We found that as a result of the pandemic, most of our Mississippi hospitals anyway were facing a lot of staff shortages, and we know that that is an issue nationwide. So how does that affect employee lactation support? Well, if staff are working long hours and they're wearing multiple hats, for one thing, it's hard to find time to get away and express milk. So it's very difficult on staff when they're overworked to be able to even take the breaks that they need. So that's one issue. The second issue that emerged was staff coverage. So if people are wearing multiple hats and working long hours and somebody has to be away from their workstation, we now have to cover for that person as well, and that can be a big challenge. So how are we going to deal with that? Well, some hospitals are telling us that they're employing a large number of temporary travel nurses. The only issue with that is travel nurses may not be as familiar with your hospital's emphasis on breastfeeding support. They may not have had their training yet, so that can be an added challenge. More than half of the hospitals that we surveyed do not have permanent dedicated space. So they're using very informal options, and that can be okay, but sometimes it's not sustainable to say, go to the conference room, and you go down to the conference room and there's a meeting going on down there. Or they say, go to the consult room and there's somebody in there having a consultation. Or they say, go use so-and-so's office, and that person is occupied on a phone conference and cannot let that person have the space. So having a dedicated room, I think, for a hospital setting is almost a must. Next slide, please, Jackie. Another big gap that we saw in our survey was in the realm of communications. You know, just because a hospital has accommodations available doesn't mean that employees know that. Most hospitals say the way employees would know about the accommodations is word of mouth. And, you know, that's not reliable for everyone. Nearly half of the hospitals in the survey said employees would only know about accommodations if they ask for them. And that is not the spirit of the federal law. The spirit of the federal law is that employers are going to make these accommodations available and communicate that to employees so that they all know about it. I have told this one story before. I'm going to share it again about a nurse that I met in the emergency room probably about a year ago. And she came back to work. She said, asked me what I did for a living. I told her, and she said, you know, I breastfed my baby. And she said her baby was like 8 or 9 months old. And I said, oh, that's wonderful. You know, how did things go? And she said, well, I wasn't able to do it very long. And I said, okay, well, tell me more about that. She said, well, I came back to work and I intended to pump here at the hospital. But she said, unfortunately, there was nowhere to pump. I work in the ER. It's a very busy schedule. My supervisor was not all that supportive. My colleagues, you know, it's like we were all covering for each other. And I couldn't figure out how to make it work. I just couldn't. And I said, did you know that this hospital that you're in right now has a lactation room that you could use to pump in? She said, nobody told me. I had no idea. She had no idea that that hospital even had an employee lactation room, and she gave up breastfeeding. Very sadly, she was very, very heartsick about it. She gave it up because she didn't know how to make it work. So I think it's really important that we make sure that not only we have the accommodations in place, but that we have a very robust communications plan in place so that all of your employees know what their options are going to be. So let's move to the next slide, Jackie, and we're going to talk now about some practical steps and some options that you could consider in making this work in your hospital setting. So I want to remind you, lactation support is more than just finding a space and making it pretty. You know, a lot of people think that's all we need to do, just find a space, make it pretty. You know, rooms have a way of disappearing. I hear this all the time. A hospital starts a lactation room, they end up needing that space for something else, and because it's not in their policy, it goes away and people are right back where they were before. So, you know, they have a way of disappearing, and just the presence of a room doesn't mean everybody knows about it, or that they're going to get the support from their supervisor and from other colleagues to be able to utilize that space when they need it. So in order to make that happen, we really encourage a very thoughtful approach. If you already have some lactation accommodations in place, I want to invite you to go back through this process if you need to, and see if there are any gaps along the way that would help you to really build on what you've started. And so there are 7 steps that I want to talk about that are part of what I would consider to be a sustainable workplace plan in a hospital setting. The first step is to form a multidisciplinary team. And Jackie, you can just scroll through these as I mention each one. The second step is to identify needs. The third step is to develop a plan. The 4th step is to develop a policy. The 5th step is to find your space. So, you know, you notice here, that's step number 5. That's not the first thing to do. It's step number 5. The 6th step is to promote and to educate. And the 7th step is to collect ongoing feedback. So if we can keep scrolling, we'll get to our next slide, which is form a multidisciplinary team. I want to talk about each one of these steps and what that means. So the first step, forming that interdisciplinary team, this can be a hard one, actually, because it's often the lactation team or the mother-baby unit that spearheads these units and these efforts. That's great that you all are doing that. But if you don't take the time to involve other important areas of the hospital, then the program may not experience the reach that it could have otherwise or be established as a more sustainable program. So who do you need to engage? Well, here's who we recommend. Of course, you're going to engage HR. You also want to engage your facility staff. If you don't already have a lactation designated room, you may want to engage your facility staff. They know where every space is in that building, and they are really creative in coming up with options and ways to convert existing space into something that could be usable. We also encourage you to include marketing and public relations. They are the experts in how to communicate the efforts that you are doing throughout the entire hospital community. We urge you to include finance and accounting, because they are going to be the ones who will be your best friends in helping you to find creative sources for funding, for any renovations that might be needed. We've understood from several hospitals that oftentimes there's a place, I don't know where this, I've never seen this place, but I've heard many hospitals have in the bowels of the hospital somewhere this room or this space where old equipment, old, chairs and couches and things are stuffed. And lots of times, rather than going out and buying new furnishings, you can often find exactly what you need in that space. And your financial people and your facilities people may know more about some of the options that may be available. We also encourage you to include different hospital departments. So include your OB department, your pediatric department, your dietary department, your pharmacy, etc. And of course, your lactation team needs to be involved. And finally, I would say, don't forget about any current or previous breastfeeding employees, because they are going to be really important in giving you guidance on what they feel is needed in that lactation space. What's really going to meet their needs, and help them to have a relaxing and a comfortable experience expressing milk. They're also often very passionate about what worked and also what didn't work for them, so they can give you some guidance on where the gaps are and how we can improve the accommodations so that they will be more effective and more meaningful for people going forward. And then finally, I want to mention you have community resources. I would urge you to involve your WIC staff, your WIC contacts that you already may work with, your breastfeeding coalition. I know we have coalitions in several areas of the state, as well as any other resources. There's a lot of great resources we're going to talk about in a few minutes. Let's go to the next slide, Jackie, and we'll talk about step 2, which is to identify needs. So I think the first role for that multidisciplinary team is to identify what the needs actually are. Think about who across your hospital environment may be in need of lactation support, and where would the biggest barriers occur. I have a lot of hospitals that often tell me that it's the cafeteria workers who are going to be in the biggest crunch, because they are working and cooking in the morning, they're getting things ready, and then they're working the busy lunch period. There's only a little bit of downtime, and then they're working, setting up for the dinner shift, and it's very, very difficult. And there's really very, very few places for those workers to be able to pump in that area. So I want you to really think about what would be the barriers of your cafeteria workers. What about your housekeeping staff or your aides in the hospital, and people who are maybe not working in the higher level positions? What are going to be their barriers, and how can we address those needs? Think about scheduling issues that might exist with different types and groups of people within your hospital setting. Who's going to be in charge of that, and how can we work with their supervisors to address some of those scheduling issues? So really think broadly, and then hone in on particularly your lower wage workers within your setting, as well as those who find it difficult, such as nurses. We do know nurses are a huge target population that have lots of major issues with lactation support because of the patient priorities. Let's go to the next slide, Jackie, and we'll talk about step 3, which is to develop the plan. So once you've convened your team, you have identified the biggest needs, the biggest barriers, your opportunities, what your options are going to be, the scheduling issues. Now you're going to look at developing a plan to address the needs that that group has identified. You're going to want to think about which department should provide oversight. So in most hospitals, we hear that it's the lactation team that provides oversight, but we also are hearing more and more that in many hospitals and many businesses, it's the HR department that actually has oversight in terms of ensuring that the accommodations are available, that the policies are in place, and that those policies are going to be communicated appropriately to the employee base. And then they often leave it to the maternity staff to then provide the day-to-day oversight of the room and providing direct assistance to employees. So you may want to think about who really is going to have oversight here, and how are we going to make sure that these accommodations are going to be sustainable. Your plan should also include things like, what policies do you need in order to sustain it? Can you build on existing policies? Does your current policy cover all the things that need to be covered? Do you need a standalone employee lactation policy? How are we going to make sure that our supervisors and managers are trained on this policy, so that anybody who is pregnant is going to get that word from their supervisor that there is going to be accommodations provided? How can you communicate that policy so everybody is going to know about it, so you continue to build that culture of support? I want to spotlight here the Southwest Regional Medical Center in Macomb. I don't know if they're on the call, if Angela or anybody from their hospital is on the call, but I will mention that I know they told me that they put their hospital policy on lactation on HealthStream. And that way all employees are exposed to the policy, and they're all required to know it. They have to pass off and sign off that they have read and are aware of that policy. So that, I thought, was just a great solution. And then you want to think about, in your plan, how are we going to structure a communication system to make sure our pregnant employees receive timely information, because they're going to be making their decision about whether they're going to breastfeed or not, partly based on how they're going to be able to accomplish that when they return to work. And they need that information during pregnancy when they're making those decisions. So what's our communication plan going to look like, so that we know that they will have access to that information? And what about breastfeeding employees when they come back to work? How are we going to make sure that they know about the accommodations? How are we going to provide coverage when the employee needs to take that break? And then just, what brainstorming solutions can we come up with? How many spaces do we need? Do we need a lactation space on every floor? Or do we need them on different wings or areas of the hospital, or in different portions of the campus if you have a really large campus? Let's go to the next slide, Jackie. I want to mention policy, just one more thing about policy. Because hospitals indicated in our survey that they wanted assistance in developing a hospital policy that would be unique to that hospital environment, the CHAMPS team has created a model policy for you. And I would really urge all of you to review this policy and think about how this could be implemented. Maybe compare your policy to this policy, see if this is something you would be able to expand your policy to bring in alignment with this policy. I want to just let you know, we developed this model policy after reviewing the hospital policies that those 7 hospitals here in Mississippi that already have a policy in place. We reviewed their policies. We also reviewed some policies from other hospitals in other states with other work that I have done with state contracts, and we were able to access some of those policies. And then we took all those hospital policies, I developed a template to kind of organize all of the themes, and then I aligned what I consider to be policy that will align with federal law. We wanted to make sure that the policy you put in place does align with federal law. It has to be, in alignment with federal law, but also maybe going beyond federal law to really meet the needs of your employees. So this policy that we have created will be available soon. It will be posted on the CHAMPS Cheer website. And Jackie, if you have any more information on when that will be available, we hope that that will be available soon. We would urge you to maybe think about integrating that into all aspects of your hospital, including your new staff orientation, as Carrie mentioned, Greenwood LaFleur does, maybe in your health stream, so that all employees that are already integrated in your hospital will know about it, and then circulate it in some way to all of your departments so that all supervisors will be aware of that. Jackie, do you have anything to add about the policy?
I don't think so. make sure to be loud and proud when it's out for everybody, so you guys know where to find it. And it'll likely be available on the website, and we'll be posting about it on our social media as well. So keep a lookout for that.
Thank you, Jackie. And yeah, we're really good at CHAMPS about communicating in a big way. So you'll be able to access that just as soon as that is available. Let's go to the next slide. We're going to talk about space. And I wanted to mention with space, you know, in a hospital environment, you have a lot of diverse space options that you could consider. So I'm going to share just a few examples of what other hospitals have shared with me over the years that they have used. And again, you're going to find what's going to work in your setting. Many hospitals will use patient rooms, particularly if there's a maybe smaller than usual patient room that they use mostly for storage and only in an emergency basis. So sometimes they'll use a room like that. Sometimes there's a treatment room that isn't used quite as often, and that can easily be converted. Sometimes patient consult rooms can be used. Little used storage areas can sometimes easily be converted, or office areas. Flexible spaces can also be considered. Doesn't have to be a designated room, although we think that's a good idea in a hospital setting. But some flexible spaces might include like a conference room, or even a personal office space of the employee, or another employee, even a supervisor. Sometimes they'll tell us supervisor will provide their office space. Bathrooms are not acceptable. However, some hospitals have converted restrooms. So what they've done is they will take a single user restroom, just a one-seater restroom, and then convert that to a lactation room by removing the toilet out of it, capping it so there's no chance of, you know, any kind of airborne bacteria, having housekeeping coming in and completely sanitizing that room so that there's no, you know, continued evidence of any bacteria, and then completely converting that former bathroom to only a lactation room. So that would be an acceptable option, but not as a bathroom. Currently as a bathroom, it cannot double, you know, in both ways. Let's go to the next slide. I will say that some hospitals tell us that they look for centralized locations, particularly near elevator banks. So this was a hospital picture I took of a hospital in Providence, Rhode Island, and they created a multi-user space by hanging curtains to provide privacy between users, and they found spaces that were near the elevator banks because they thought that would make that easier for people to get to and get away from their workstation, get to the lactation space and back to their workstation. So that, of course, is something to consider. Some hospitals tell me that they look for spaces along a main plumbing line in the hospital. And by doing that, they're then able to install a sink. Now, the federal law doesn't require that a space have a sink in it. We think it's a really good idea if it's possible, because the employee needs to wash their hands and they also need to wash out their breast pump parts. And if the only space available to do that in is in a public restroom, you know, you've got that issue of airborne bacteria. You know, if you can't install a sink, try to do it near a space where there's a kitchen or a sink somewhere where they would be able to access that. Some hospitals have told me that using a patient room really works well for them because there's already a sink in the room. There's a restroom right there. So a mother who is pumping would be able to use the restroom and take care of her personal needs, as well as be able to wash her hands in the room area. So, you know, that's an option if that is available for you. Let's go to the next slide. You want to consider whether that space is going to be in a quiet area and where women will feel safe. And the reason for that is, of course, we know that milk will flow better when a woman is relaxed. We know that the hormone of oxytocin has to be released to allow milk to flow. And in order for oxytocin to be released, the mother needs to be very relaxed. So whatever you can do to make that space comfortable and relaxing, and to help that mother feel very safe. This is a space at the Southwest Mississippi Regional Medical Center in Macomb. And one of the things I just thought was a beautiful space. They had a lot of amenities in this room. I think they must have talked to some breastfeeding moms or maybe had a lot of experience with this, because the space is very, very accommodating. So among their amenities, they have a nice rocker so that the employee, if she has her baby there with her, rather than expressing milk, she wants to directly breastfeed, that would be an option. And I will tell you, in your policy, you want to make sure you address that. We think it's a good idea to say that your space can be used for either direct breastfeeding or for milk expression. Doesn't mean the baby necessarily has to be with the employee all day, and a caregiver could bring the baby up to the employee for direct feedings, which is always a great option for the employee and helps her reconnect with her baby and deliver more milk to the baby as well. There's a changing table they put in their room for that purpose, because they do allow the employee to directly breastfeed if she chooses to do that. They have a sink in the room. There's a soft lighting in there, which just allows them to maybe turn off those overhead fluorescents and have the room just a little bit softer. There's a mirror in there, which I think is a great idea. So that way she can readjust her clothing after she's through. There's a curtain between the milk expression area and the door. So if somebody accidentally or somebody else has a key to get in and they open that door, they'll see that somebody's in that room without seeing the person exposing her breast. So that just gives that mother some extra security and that feeling of safety. There's a lot of lovely, knickknacks in there and other things to really make that room very welcoming. So I think they just did a great job with their room. Let's look at the next slide, Jackie. This was a picture of a hospital in Van Nuys, California. I visited their space, the hospital, Valley Presbyterian Hospital, and they had this very small little storage area. They got all the stuff that was in the storage room and converted this little room. And they didn't really have enough money to do a whole lot, but they said, paint can go a long way toward making something very cheerful. So they painted it kind of an unusual shade of green. It's actually quite attractive when you are in that room. They put a plant in there, which really made it very cozy. They were able to install a sink, and they put some artwork in there, which I thought was beautiful. They found some beautiful black and white photos of babies just to help a mom relax and to feel she's in an environment that supports what she is doing right now with this baby. Let's go to the next slide. And I'll show you a picture of a hospital in Washington, D.C. This is the MedStar Georgetown Hospital. This is one of their multi-user rooms, and they used a patient room as well, converted it to a lactation room, and they also use curtains to provide privacy for individual users. What I really love about this space, it's very welcoming, some nice artwork in there, but you see a television in there, which I thought was a really awesome idea, just having something to help the employees to be able to relax and enjoy themselves while they're pumping, which helps the milk to flow better. If you can get that milk to flow more quickly, more easily, then, they're going to be back at work more quickly as well. So let's take another, I guess I'll have one more question that sometimes comes up, and that is, can staff and patients share the same lactation room? And I think the answer to that is whatever you all feel is necessary. Some hospitals do allow that. They will say the space can be used by patients or it can be used by staff. But keep in mind that you are required by law to accommodate your employees. So if patients have first rights to use that space and employees cannot pump because a patient is using it, then that's a problem that's going to have to be resolved. So you'll just have to make sure that if you're going to allow your space to be used by both, that your employees will be able to pump whenever they need to pump as well. We can go back to the next slide, Jackie, on the lactation pods. We're seeing a growing number of hospitals using these little pods, and they can be locked on the inside. They have, it's very small, but it is very private. This is a picture of a pod. I believe I took this picture at an airport in Burlington, Vermont, but they can, the company that makes these can put anything you want on the slide. They can imprint them with whatever you want. And then these little pods can be put anywhere throughout the hospital. So you see the brand name of this particular company. I think there may be other companies that produce them, so we're not necessarily endorsing this company, but that is an option that some hospitals are going with. In fact, they are doing a lot of work with hospitals nationally right now. So you might want to check out their website and see, what might be involved if you don't have space. Let's look at the next slide, Jackie. I want to remind us that because you are a hospital and you already have multi-user breast pumps that are available for your patients, I would just urge you to consider making a hospital-owned multi-user pump available also for your staff, or maybe acquiring an extra couple of pumps that could be used for your staff. It just goes a long ways toward helping your staff to make sure they are able to use a high-quality pump that will be most effective in helping them to release milk. Again, the more efficient they are at removing milk, the faster the milk flows and the quicker they're going to be back at work. Some hospitals will provide an accessory kit for their employees. Some hospitals will subsidize the cost, so they'll pay a certain portion, the employee will pay another portion of it. And in some hospitals, the employee buys their own kit to go with that pump. So you've got some options there. I want to also remind you, as a hospital, you also have an added advantage of having a lactation team on staff. And we urge you to allow your lactation experts to be available also to your employees, because oftentimes when employees return to work, it can be challenging to maintain milk supply when you're pumping for a baby instead of directly feeding a baby. So just being able to know who you can call at the hospital, who can help you to maintain your milk production, or just if the employee runs into any challenges, just a tremendous added benefit you can offer that other businesses are not able to offer. So we would urge you to consider providing that. Now, another question that has come up a lot to me is, as I've worked with different states, is the use of wearable breast pumps. Could a staff person be asked to use a wearable pump? And that's just a pump that they wear inside their bra, and milk is released while they continue going about their duties. They're still seeing patients, they're still working, and then their breast is releasing milk while they're doing that. So a lot of hospitals have asked me, could we require our employees, if they're going to come back to work and want to continue breastfeeding, that they use a wearable pump? So my concern about that, some employees do really great working and pumping. In fact, if they're not thinking about the pump and they're not looking at every drop that is dripping into that milk collection container, they actually get more milk out. So some employees love that. But I've also talked to a lot of employees who say they can't use those wearable pumps. They don't work for them. They just don't release milk as efficiently as a multi-user pump does or their own pump does. So I would just caution you not to require that, but to maybe make that an option. You will have to decide if you want them to wear a pump while they're still serving patients. You may or may not want to do that. That's going to be up to your hospital to consider whether that's something you want to consider. Also, I want to just remind you, as a hospital facility, if you provide breastfeeding classes, and if you're a baby-friendly hospital, no doubt you do provide breastfeeding classes or maybe support group meetings, but I would urge you to make those available to your employee base as well. The more we support our employees, the more we transform our entire culture, which as a whole affects your patients as well. Next slide, Jackie. There are some, of course, special issues in a hospital related to staff coverage, which will require a little bit of creativity. So what other hospitals have shared with me have worked. One option is to ask the nurse manager or the assistant nurse manager to provide coverage when a nurse needs to pump milk. So we've seen a lot of hospitals have done that, and they found that that's been pretty effective. Some hospitals have used floater nurses to cover shifts when nurses have to be away, and that would include when they're away expressing milk. You'll have to make sure that all of the different divisions of your hospital have a system in place to provide coverage. It should never be left up to the employee to figure that out. It is the responsibility of the employer or in this case, in a hospital, would be responsibility of your supervisors and your managers to arrange coverage. Some staff will schedule their milk expression breaks right before their shift begins. So they'll go and express milk right before they begin their shift. And that allows them to, again, to have one extra little pumping session before they begin that shift. Some hospitals tell me that staff just cover for one another, that they work on a buddy system, and they more informally just cover for each other, and they'll tell each other, I've got to go pump now. I'm about to burst. And they'll tell each other, I'm fine. I've got your patients for you while you're gone. So you want to make sure you're addressing this, though, and that you maybe address this in your policy as well, so that no employee has to feel that they're on their own trying to figure it out. And if they're running into resistance, it can make it really, really hard for them. I want to mention to you that CHAMPS has the 3-hour interprofessional education module, or IPE. If you have a lot of travel nurses that are coming into your hospital, you might want to consider suggesting that they go through this free online 3-hour IPE, just to give them a heads up about the importance of breastfeeding and why we do this, until they're able to go through their lengthier baby-friendly training. One of the advantages of the IPE training is we have a whole section there on workplace support. So that would be a great way for new staff coming in to, very quickly get some information on why workplace lactation support is important. And then remember that in some of your shifts, like your cafeteria workers, they may need some different scheduling options. One hospital told me that they had their cafeteria workers were able to take split shifts. So what that means is they would come in and work right before the busy lunch period, right afterwards, and then they would take a break, and they would either go home for a period and come back for the dinner shift, or they would use that downtime between those busy shifts, or they would pump right before the busy time period begins, and then pump right afterwards. So, you're going to have to be very creative with different shifts. Next slide, Jackie. We want to also mention again the importance of promoting and educating, get the word out to everyone. Some hospitals will plan a big event, like a big ribbon cutting event. This is a picture I took at a ribbon cutting event. Invite the media so that you get a lot of local publicity in the community. People all know what you're doing. It really goes a long ways to building recognition for your hospital. Some hospitals told me that they've hung posters in the employee break areas. They included in new staff orientation, as Carrie reported. Many of them have told me that they will actually, as part of new staff orientation, when they take their hospital tour, they are sure to include the lactation room as part of that tour. I think that's a really great idea as part of that onboarding process. Also, the hospital newsletter, your website can also be another place to provide that information. Next slide. We want to remember that pregnant and breastfeeding employees need to also be individually informed about worksite lactation support, because they're going to be making their decision about breastfeeding based on whether they think it's doable when they return to work. So I want to make sure we have some plans in place for that. So some options to consider. Some hospitals have told us that they do supervisory training, even web-based training for their supervisors and for their employees. Sometimes the communication occurs during direct communications from HR. Oftentimes, employees will have a meeting with their HR person. They call it their FMLA meeting, perhaps before they take their leave, and that the HR will then tell them during that FMLA meeting that they're going to be provided with lactation support when they return, if your HR person knows about it. Of course, that's why HR needs to be integrally involved in this. I think if you can spotlight lactation support in your hospital newsletter periodically, having information on your website, if you have an employee-only section of your website, that you have information about that. And then just encourage all of your employees to share with each other when they realize that an employee is pregnant. If they'll let them know, just want to let you know, if you decide to breastfeed, we're going to be providing that support for you, and we have accommodations so that they know as early as possible in their pregnancy. We had a supervisor at a Goodwill store in Indiana that I met with a few years ago. And he told me he always, whenever he finds out that an employee is pregnant, one of the first things he does is he sits them down and says, I want you to know that during your pregnancy, I'm going to accommodate you. If you need to take leave for a doctor's appointment or anything that's going on, you keep me informed. I'm going to work with you and make sure that you have your needs met. And after your baby is born, if you decide you want to breastfeed, we're going to support you with that too. And he's had almost all of his employees who got pregnant while they were working for him, all made the decision to breastfeed because he pointed that up to them in their pregnancy. I would love to see every hospital supervisor and manager share that kind of information with their employee. It just goes a long ways toward helping them to relax. Next slide, Jackie. We want to remind you of the importance of ongoing feedback. So you need to, look at ways to make sure that your accommodations are meeting the needs of your employees. So you might want to think about maybe an employee exit form or lactation exit form. So when they're no longer using the services, they can fill out a form to say what went well, what didn't go well, any recommendations that they may have. Some hospitals will have like a little binder or like a little spiral binder or notepad in the room, and they'll tell employees, if you see anything that needs to be improved, let us know, put it on that little notepad. And then somebody who's providing oversight would check that periodically to make sure that that those concerns are being addressed. We find that sometimes employees will leave messages for one another in those books, and they'll encourage each other. Letting each other know, you've got this, mom, we're behind you, we're supporting you. And so that type of employee to employee communication is also very, very powerful. Many hospitals will put bulletin boards in the room, and they'll allow the employees to put pictures of their baby on that bulletin board. And then they look at their baby's picture, but they also look at all the baby's pictures of other babies, and just cheering each other on goes a long ways. Let's go to the next slide. I want to remind you, CHAMPS is here to help you with implementing or enhancing your accommodations. If you have questions or concerns, please feel free to reach out to me. I'm happy to have a phone conversation with you or a Zoom meeting to help you walk through your situation. I'm happy to meet with your HR director if you'd like for me to do that. That's something I can do for you. We are working currently on developing a toolkit with hospital-specific resources and sample checklists and implementation forms that you can use. We hope to have those available by the end of the summer, so we're really excited about that. In the meantime, you can check out the Mississippi Wins section of the Cheer Equity website. We have a very robust platform full of lots of great links and resources and other materials that may be helpful to you. Next slide, Jackie. We'll go through these pretty quickly. We also wanted to mention the HHS Office on Women's Health also has a very robust website with a lot of resources as well. They also have a YouTube channel with 29 videos that feature solutions in major industries, including hospitals. And if we have time at the very, very end here, we'll show you one of those. But Madhav, if you will put the link to the MedStar Georgetown University Hospital link in the chat box, we can at least have that. If we don't have time to show it, I'd love for you to watch it. It's a great video about how they implemented lactation support in their hospital. Next slide, Jackie. I want to mention A Better Balance, which is a nonprofit organization and provides great resources, as well as this guide for healthcare professionals. Better Balance is part of an organization called Work-Life Law, the Center for Work-Life Law. They have a lot of great information on worksite support. Next slide, Jackie. Oh, here's the Better Balance, their URL. Madhav, if you're able to put some of these links in the chat box, that would be terrific so everybody can check those out. A Better Balance has a really great resource called How to Talk to Your Boss About Your Pump. And it is state specific. So you can go to their map and click on your state and have a resource that you can share with your employees that lets them know what their rights are in your state. Each state has different laws and different guidelines, and it just provides a lot of great resources for how to have that conversation with your employer. Next slide, Jackie. The CDC has guidance during COVID-19 that also includes guidance for lactation spaces in workplaces. So this is a really important link, and Madhav, if you can put this URL in the chat box as well, that would be terrific. And actually, after the webinar ends, it might be great if we could put all of these links in an email follow-up to everybody, and that way those of you who are not able to access links out of the chat box would be able to get them in an email.
Yes, we're going to make
Jackie.
links available after the meeting, Kathy.
Fantastic. The next slide has another document for a resource that I created for the Ohio Department of Health that was part of their statewide worksite lactation program. It's called Considerations for Safe Worksite Lactation Spaces During the COVID-19 Pandemic. And that is also available on their website. There's a lot of great things to consider. So with that, we'll end our webinar for the day. We have about 2 minutes left. If anyone has any questions or just any comments about maybe anything you're doing in your hospital you would like to share, we've got just a couple of minutes here. If anybody would like to unmute and share your ideas with us.
This is Tawanda.
Hey, Tawanda, congratulations, by the way, everybody. She is a brand new IBCLC, just got her word back today. So we're very happy for you, Tawanda.
Thank you, thank you. I just wanted to share how important this is, because when I was in during my breastfeeding journey, I actually worked at Greenwood-LaFleur Hospital as a social worker. And we didn't have a room, you know, at that time. And I'm just getting back in the office. So I had to run here and there, here and there. I shared a room with a male social worker. So if he needed to use the room and I needed to pump, I couldn't do it at that time. My supervisor, she tried to let me, you know, use her office from time to time, but, you know, she had to be in there at times as well. And we had a little restroom across from our office, but it didn't have a socket in it, outlet. And I had a battery pump, so I put batteries in it. Batteries ran down, so it was so hectic. And I really can't stress enough how important it is for this to be available for employees, because it did affect my breastfeeding journey. And I didn't breastfeed as long as I desired, but you know, I'm glad that now that's accommodating for the employees of Greenwood-LaFleur.
Wanda, and wow, bless your heart. This is exactly, you know, why this is so needed, not just for nursing staff. It's important for all aspects of your hospital, everybody who works in your hospital. And anytime somebody's in a situation like Tawanda was in, where you're working with a male person and even another female, not everybody is comfortable, you know, exposing their breasts in front of somebody else, and not everybody's comfortable working in an environment where the person next to them is pumping. We need to make sure we are accommodating their needs. Tawanda, I am so sorry you were not able to meet your breastfeeding goals. And it's a shame that it, you know, something that could have been fixed and obviously has now been fixed, you know, that you were not able to access that support. Hopefully going forward, though, now Greenwood-LaFleur is a model hospital. We're so proud of all you have done. And we're so happy for all of the hospitals that are implementing some things to make it better for their employees to be able to meet their breastfeeding goals. That's what it's all about. Let's meet them where they are and give them what they need. We shouldn't be the stumbling block that makes it impossible for people to meet the goals that they have set. Any other comments? And I think our time is about up. Tawanda, you ended us on a great note here, so thank you for that. And Jackie, I'll turn it over to you if you have any closing comments to close us out. I want to thank everyone for participating and thank you for your interest in this topic. And we hope that you will be inspired to go back and and do some major things in your community and in your hospital to turn this around.
Thank you all so much. Again, this recording, as well as the links that we discussed, will be made available at a later date, and we'll make sure that that gets sent out to everybody on our website, and it'll be on social media as well. Thank you all so much for participating. Thank you, Cathy, for a great presentation, and have a great day.